common eye diseases that normally would affect children. I dealt with pink eyes, conjunctivitis extensively in one of my videos. Feel free to go and watch it in that video. You will understand better what pink eye is. It's very, very common among children. So most of us who have children, try as much as you can to pay attention, because our children touch so many things. They touch so many things and they could get infected. You could have viral conjunctivitis, you could have bacterial conjunctivitis, you could have allergic conjunctivitis. Some of the signs are red eye, discharge, and itchy sensations. You see the child rubbing like they want to pluck off the eyes. That is something to look at. Number 5 is retinopathy of prematurity. I will call it ROP. It happens when the retina is not fully matured, and you see it more in premature babies, and you see it more in premature babies where abnormal blood vessels grow is inside the retina, and it can lead to blindness if left untreated. Another one is congenital cataract. If some people don't know because they never block one eye or block the next eye to see. Congenital cataract is found in babies when you notice a child with a white pupil. The center of the eye is white. We call it, you see signs of white reflex, you see poor vision in that eye, and most of the time the cataract has to be removed. I have dealt with glaucoma extensively. So feel free to go and see all my glaucoma videos. Most of the things we see in adult glaucoma, we can also see it in children with glaucoma. Though very, very uncommon, but congenital glaucoma exists among children. You will notice that they have large eyes, they are very light sensitive, and they have SST. But the most common one that we cannot ignore, and a lot of parents want to fight it, because I am not wearing glasses, why should my child be wearing glasses? Most parents speak like that, and I've experienced it in my over 20 years of practice. Parents think that because they don't wear glasses, their children don't need to wear glasses. Refractive error, that's what we call that problem. But you can also call it uncorrected visual problems. Refractive error is your short sight, your long sight, your astigmatism. These problems can be very, very troubling. A number of times, if you see a child who is not performing well in school, it is very likely that they are not seeing well. If they are not seeing well, they most likely will not respond well to learning. They most likely will not respond well to teaching. So pay attention, do a proper eye test. Some people want to rely on the screening that they do in their schools, and they'll tell you, oh, some people came to the school and they did some eye tests. They said my child's eye is good, so I don't need to. No, that is a screening. That is not a proper eye test.